The COVID-19 Omicron variant continues to spread across the country. Health authorities continue to urge people to get vaccinated. The department is hosting Vuma Vaccination Week until the 10th of December. Civil society organizations and the private sector are taking part in the vaccination drive by setting up a host of pop-up sites. The aim is to mitigate the impact of the fourth wave. For more on this, we are joined by Dr. David Harrison from DG Murray Trust. Thank you so much for your time, Doctor. I think let's first just start off with whether or not these Vuma vaccination weekends actually work and whether we've seen an increase in vaccinations in the context of Omicron.
Yes, we know that that over the last 2 months or so, there has been a decline in overall vaccination rates. That's of concern. But what has made a difference has been the galvanization of political leadership and support around Vuma vaccination weekends. And in both the one held in October and again in November, we saw a spike in vaccinations that was sustained into the next week. So they are important. Over those 2 weekends, a total of 600,000 and more vaccinations were done. And that's why we've made this next Vuma weekend an entire week to try and capitalize on the energy and the drive that the Vuma brand brings.
Dr. Harrison, there's a lot of vaccine hesitancy in South Africa, and we know that a large part of the population is still not vaccinated, especially in terms of where government would have hoped the vaccination numbers would have been at this stage. What do you think more should be done other than the Vuma vaccination weekends to try and get people to vaccinate, especially because we do know how highly transmissible Omicron is, and health experts saying we need to get vaccinated. This is basically one of the best tools to try and fight off this pandemic.
Yes, we have this sort of very strange phenomenon where, on the one hand, the science is clear, and we see from hospitals that people that are vaccinated have far less chance of dying, 10 times less chance of ending up in hospital, 10 times less chance of dying. So we have the facts on the one hand, but on the other we have the strange hesitancy, the strange reluctance of a lot of people to come forward. And I think it's a combination of sometimes not having the facts at their disposal, but often just a sense of some niggling anxiety, some distrust, and we have to get people over the line. And so I think one of the most important ways to do that is to use the networks of trust, the spaces that people go to. So faith-based organizations, faith leadership, traditional leadership, women's groups, these very sort of down to earth, grounded networks in which people feel comfortable, that they trust each other. Those are absolutely vital in achieving vaccination. But then I think we have to go further. We've got to incentivize and encourage, and particularly over half of those who are not vaccinated are young people, 18 to 34. And many of them have little to lose. And so finding ways to incentivize them to provide even, for example, airtime data for those who come forward may well just be the nudge that they need. And I think increasingly we're going to see the private sector and others coming to the table and being willing just to assist a little bit to get people over the line.
I think the burning question here, Doctor, is whether or not these vaccines are effective against Omicron. Many are saying, what's the point of getting vaccinated if we don't even know if these vaccines are effective against this new variant? What are you able to tell us about the efficacy of the vaccines against Omicron?
Well, it's obviously very early days, but what has already been reported from the hospital is that those people that are seriously ill, that have been admitted to ICU, or in fact, the few cases that have already died, those people almost without exception are not vaccinated. And so we'll watch this carefully over time, but already within a week, it's clear that people who vaccinated have the advantage that they're more likely to survive than those who don't. And that's not surprising because the body's immune system works in different ways. And even though Omicron may in fact mean that some of the antibodies that the body produces don't work as well. There are other techniques. The body has other immune techniques, white blood cells that very quickly move the infection out of the body, which gives less chance for infection. We call them T memory cells, and they seem to still be working. And so even if vaccines are not that effective in preventing transmission of the virus, what they do still seem to be effective is in reducing the severity of the disease. That's what we see early on.
Doctor, there are reports that more children are being admitted to hospital. Is that correct? And what does this actually tell us about how things are changing? Previously, it was those 60 and above, 50 and above that were being admitted into hospital. But this time around, it seems as though the younger population is being hospitalized.
Well, again, it's early days, and certainly with the third wave as well. We saw that while there were more beds in the hospitals, while there wasn't huge pressure, doctors tended to really sort of err on the side of caution, admit people and admit children, particularly because children can go down very quickly. So what we've seen at the moment, and what seems to be emerging from the reports, is not that those children are very sick, but that doctors are just being careful. But we also shouldn't be surprised that the proportion of people that are admitted to hospital and the proportion of people who die, in fact, in younger age groups, will start to increase. Why? Because rates of vaccination are higher in older people, and so fewer of them will end up in hospital, fewer of them will die. And so while overall the number of people who die will be less, we'll slowly start to see a shift from deaths predominantly and hospital admissions predominantly in older people to a younger age group as well.
Great. Thank you so much for your insights. That's Dr. David Harrison from Murray Group. I just want to bring you some interesting stats, though. The vaccination coverage has increased since the discovery of Omicron variants, with 43% of South African adults fully vaccinated as of December, as of the 4th of December, when, in fact, we heard about this Omicron variant. It's an 8% increase since November, when this Omicron variant was discovered. So it seems as though the call for vaccination is being adhered to.